Hello everyone, myself Dr. Dinesh Chavhan. I am a neurophysiotherapist. Welcome to Dr. Dinesh Chavhan neuroPhD YouTube channel. Today we are going to discuss a very good technique called as PNF technique. So in that PNF technique, we will see first PNF pattern. So there are upper limb pattern, there are lower limb pattern. So upper limb pattern we are divided into D1 flexion and extension, D2 flexion and extension. Then what is mean by D? D means a diagonal. Okay. So diagonal म्हणजे किती diagonal असायला पाहिजे? So diagonal, I'll tell you how much diagonal position. So on the clock, everyone knows the watch. Okay. So we assume that 12 on the watch is the head and 6 is the leg. Okay. So from 12 we know the 11 and we know the 1. Okay. 6 we know the 7, we know the 5. So how much diagonal you have to go from head, that is 12 to 11 and 12 to 1. So 11 coincide with your 5 and 1 is coincide with your 7. So this is how much you have to diagonal. Okay, so now we'll start with actual demonstration. So before that, you should know PNF principle. So what are the principle when you are performing the PNF? You have to use. So very basic procedure you should know. First is diagonal. We already discussed how much is a diagonal. Then your contacts, manual contact, how you are holding. Okay. Then position of the patient, position of the therapist, the stance. If you see the dynamic of the therapist, so physiodynamic, so you have to make the T, okay, like this of your foot. Okay. So from here you have to move like this. So this is how much you have to be a diagonal and dynamic. Then you have to use a resistance. You have to use a irradiation. You have to use a reinforcement. Then what is the position? That is vision. It has to movement has to be in a vision. So this all the basic procedure we will follow and we will see how to perform the demonstration. Okay. So if you want to perform D1 flexion, so initial position will be a D1 extension. Okay. So you should know what are the D1 extension initial position. So start from scapula till your finger. Okay. So initial position, I'll explain you initial position for a D1 flexion. We are going to demonstrate D1 flexion. So position initially will be a D1 extension. So D1 extension, so hand will, the movement, if you see, the scapula has to be depressed, posteriorly depressed. Okay. Then extension of the shoulder, then abduction. Okay. Then internal rotation of the shoulder. Elbow is an intermittent joint. Okay. So elbow is an intermittent joint. Flexion or extension, we'll choose first extension. Then you see here pronation of forearm. Then wrist is in extension. Extension goes with the ulnar deviation. You can call it ulnar extension. Ulnar deviation, abduction of the thumb, finger extension and abduction. This is the initial position. Okay. So from here we are going to perform D1 flexion. Okay. So it is down actually. We will see little bit up so that you can see from here. So position from here, the distal to proximal movement. Okay. So one component you just look at the one component will perform. Then hand grip. So grip has to be again as a lumbrical grip. And when we want the movement from distal, your hand has to be again at the palmar side. Okay. Then the distal hand at the palmar side and then proximal hand the down with the wrist. Okay. From here. So one command I will give. Okay. What you have to do? Hold my hand. Okay. Twist. Yeah. Hold my good. Take it down. Take it down. Yeah. So we see flexion of finger, flexion of wrist, okay, goes with radial deviation. Now I'll give little bit traction, okay, first elongation, you keep stretch, then now you turn, okay, Now give the command. Yes, maintain the traction. Give the command. Try to touch your hand to your opposite ear. Okay. Yeah. Take it up. Take it. Take it. Take it. Try. Try. Yeah. So this is the end position. So what happening in the end position? The scapula is anti-elevation. Shoulder is in flexion. Okay. Shoulder is in adduction. Shoulder is in again external rotation. Elbow flexion. Forearm supination. Wrist goes in flexion and radial deviation. Finger flexion. This is the end position. Okay. Thank you. So now what are the uses? Okay, so now what are the functional uses? आपण कधी वापरतो PNF? So most of the time student and the patient will have, okay, we did the PNF pattern. What are the use? वापर काय आहे त्याचा? तर वापर असा आहे की आपल्या ADL activity. Example, just the combing. If you see the combing, what you are doing, your D1 flexion. This movement is nothing but D1 flexion. Okay. So next is eating. आपण जे जेवण करतो, काय करतो आपण? D1 flexion. Okay. Especially female cases. What they do if they want to wear something in the ear? Nothing but the D1 flexion. Okay. So the male, if you want to do a saving, what is saving? Nothing but D1 flexion. So taking from something down is a D1 extension position. Okay. And doing the activity is D1 flexion position. Okay. Then these are the simple activity आपण नेहमी आपल्या दररोजच्या जीवनामध्ये आपण दैनंदिनसाठी आपण जे जेवण करतोय, आपण जे सेविंग करतोय, आपण जे कोमिंग करतो, आपण जे एडीएल वगैरे करतो, हे सगळ्या ऍक्टिव्हिटी, ब्रशिंग करतो, ह्या सगळ्या ऍक्टिव्हिटी इज नथिंग बट D1 flexion. Start from D1 extension, we do a D1 flexion. And again, if you see these activities, combination of three plane activity. Okay, flexion, abduction or adduction and rotation. So two are sagittal plane, frontal plane, one are in the rotatory plane. So all the activity we do in a rotation. Okay, so this was the demonstration for D1 flexion and we saw what are the daily uses. Okay, thank you.